Hi, I'm Heaven, and today I'll be speaking about music therapy on brain-injured patients. In 2013, my dad had an unexpected brain injury. He had a brain aneurysm burst, and he ended up in the hospital from April to July. About 2 weeks before the brain aneurysm ruptured, he had a severe headache. If these brain aneurysms go unnoticed, then they will eventually burst and likely lead to death. My dad was lucky, though, and survived with few complications and went through many therapy sessions along with music therapy to get him to recovery. Brain injuries occur every day, whether it is traumatic or not traumatic. In order to improve the brain's functioning after a brain injury and to get the patients back to their everyday lives, patients go through physical therapy, speech therapy, and other types of treatment. Many of the types of therapies used for brain improvement have been ineffective in improving the cognitive, socio-emotional, and sensory motor skills. Therapists decided to do the music-based attention assessment that challenges the patient's attention ability and music stimuli by using various combinations of sounds in order to mimic existing real-world auditory events. Incorporating music into therapy and music-based assessing of patients is essential for getting the patient back to where they need to be because music can activate the attentional system. Rhythmic facilitation enhances timing of gait movement in traumatic brain injured patients, and music therapy causes the patient to have feelings like composed, energetic, and agreeable after music therapy sessions. Elements such as rhythm and melody can activate the attentional system, depending on the manner of listening to music. As found in works of musically induced attention and attention to non-auditory tasks, the neural structures specific to different types of music are similar to those observed in tasks other than sensory modalities, according to Yoon-Ji Zhang. The prefrontal cortex, which is located right here on the brain, plays a big role in sending relevant information to nearly all posterior sensory brain regions, leading assurance to the anatomical plausibility of such a role of the prefrontal cortex. Several researchers have provided evidence to support the use of music stimuli for auditory attention assessment by reaction time, error detection rates, and simple identification to single/multi-voice stimuli. The results also reveal that an individual's capacity to attend to music can be affected by the way musical components are manipulated. These findings suggest that the responses to single/multi-voice music can reflect a person's attentional capacity and have potential for measuring the capacity. Therefore, the appropriate use of music is effective in measuring different types of attention ability. Another method used by physical therapists is the rhythmic auditory stimulation, or RAS. This method was used to cue gait patterns in patients with traumatic brain injury who were no longer making progress towards conventional therapy goals. An important part of well-coordinated movement involves proper timing. Traumatic brain injury often results in issues with posture, stance, and gait. Rhythmic therapy to enhance timing of gait movement can improve velocity, cadence, stride length, and symmetry, as has been previously demonstrated in gait training with stroke and Parkinson's disease patients, according to Corinne Hurt in their article, Rhythmic Auditory Stimulation and Gait Training for Patients with Traumatic Brain Injury. To prove that this is true, Corinne Hurt conducted 2 different experiments. The experiments took place in the Gait Laboratory of the Center for Biomedical Research in Music at Colorado State University. During the first experimental session, the test subjects walked 4 times along a 10-meter walkway. Subjects were instructed to walk at their normal pace in order to compute an accurate calculation of their internal baseline stride pattern. During the second walk, the subjects were asked to walk on the beat to RAS presented by a metronome embedded into accented music. The second experiment offered evidence that over time, training with RAS can result in statistically significant increases in velocity, cadence, and stride length, even when the patient is no longer making progress in conventional therapy. The training effects were achieved with patients who were all past the initial phase of 3 months. 3 months for rapid neurological recovery, where most important therapy benefits are to occur. The experimental design of this study compared patients with themselves using the pretest as a stable indicator of the effects of the previous therapy, rather than using control samples that are hard to match in the traumatic brain injury population. Thus, these results provide encouraging evidence for the music therapist that RAS can facilitate long-term gait training in traumatic brain injured patients. The effect of music therapy as a clinical intervention to improve mood states is widely reported within published clinical case studies and has also been demonstrated with a variety of populations, such as depressed older adults and forensic parents, as Wendy McGee states in their article, The Effect of Music Therapy on Mood States in Neurological Patients, a pilot study. One randomized study examining music therapy with stroke patients produced results approaching statistical significance for improving feelings of depression and anxiety. Another recent study with individuals with traumatic brain injury and stroke found that trends suggesting mood improvements were greater for the treatment group than the control group in self and family ratings. Analyses were carried out on each of the mood subscales selected from the Profile of Mood States bipolar scale: agreeable to hostile, composed to nervous, energetic to tired, and elated to depressed. These tested the main effects of the pre/post measures, music therapy condition and diagnostic group, in addition to the 2 interactions between each of these and the 3-way interaction overall. The positive changes found in mood states composed anxious, energetic tired, and agreeable hostile after music therapy intervention are important when considering the reality of patients who have acquired severe and complex neurodisabilities. In mood states, the change in mood states were continuously improving, suggesting that music therapy intervention resulted in feelings, which were more towards composed, energetic, and agreeable mood states after music therapy sessions. Often people with traumatic and non-traumatic brain injuries make little to no progress in cognitive, socio-emotional, and sensory motor skills. Therapists decided to challenge the patient's attention ability and music stimuli, incorporating music into therapy practice and music-based assessing of patients is essential in getting the patient back to the level they were once at, because music can activate the attentional system, rhythmic facilitation, improves timing of gait movement in traumatic brain injuries, and it causes the patient to have feelings like composed, energetic, and agreeable after music therapy sessions. Music therapy is a method that can help any patient achieve positive results.